In today's Health Watch, we're focusing on Men's Health Month. It's important to maintain regular wellness visits and screenings, and many men don't get themselves checked out as often as they should. So Dr. Scott Joy joins us now from Health One, and thanks so much for joining us. First of all, let's start with how often should men get checkups and screenings? I know that can kind of vary by age.
It does, and I think it is very important for men to get yearly checkups beginning at age 50. Earlier than that, it can be anywhere from 1 to 5 years based on either family history or medical history and personal risk factors. But after 50, definitely get in once a year to talk to your primary care physician.
Absolutely. It's so important. Colon cancer screening suggested at the 45-year-old mark, but sometimes symptoms can show up before then and then be missed. So what are some of the other screenings you recommend after certain symptoms?
Yeah, good question. I think there are major cancer screenings in men. We think about colon cancer screening beginning at age 45 up to 75. One of the big opportunities to increase cancer screening is for lung cancer. So any men who have a current or previous smoking history should be assessed for lung cancer screening, usually at age 50 to late 70s. So that's if you're smoking a pack a day of cigarettes for approximately 20 years, that would put you at high risk. If you have quit within the last 15 years, you still need to be screened. And I think one thing, Mackenzie, that we're finding is that there is a slight increased risk in testicular cancer in younger men who use frequent marijuana. So if they're using marijuana 2-3 times a week, we're starting to see a small but significant increase in testicular cancer. So any testicular pain or swelling, that's something you want to talk to your provider about.
Interesting. That's great information. What do you think is missed the most among men that maybe could have been caught and treated if it was done earlier in a regular checkup?
Well, I think there's always an opportunity to do better at screening for heart disease. So we want to get patients, men in for their blood pressure check on a regular basis. We want to look at cholesterol levels. A lot of men are very proud of their bad or LDL cholesterol number. What I tell my patients is it's more important to understand your 10-year risk of heart disease. That number should be less than 7.5%. If it's not, you should talk to your provider about medications or other things you can do to reduce your heart disease risk. But I think one of the big opportunities we have that's under-recognized is hearing loss. So for our Medicare annual wellness visit, we do a yearly hearing test. And the reason why that's important is hearing loss is an independent risk factor for developing dementia later in life. So if we can intervene and find men who have decreased hearing early in their life, we can hopefully prevent them developing memory loss later in life. So a very important check at your wellness visit to get a hearing test.
Yeah, absolutely. That is some great information, and we really appreciate it. Thank you so much for joining us and sharing that with us. It's been great.
Yep, thank you.
Absolutely. And you can watch all of our health interviews right now on cbscolorado.com.